Hello.
Good evening.
It's very exciting. We've had our first rain.
I know.
And thunder.
And there was a rainbow, and I was super excited.
Oh. Hi, guys.
Little things excite me like that.
All right.
Welcome.
Starting us off?
Yeah. So today we are going to be talking about gentler C-sections. We'll go ahead and do our little introductions in case this is your first time watching or if you're watching the replay.
Hi, Kim.
Hi, Kim. Can't have to get that in there.
By the way, I had to invite her to like our page. So if you haven't liked our page, like our page.
Kimberly.
And you'll get all the notifications and all the good stuff. We're always posting great articles and fun memes. And so come party with us.
Definitely. Okay, so who are we? We are Jen and Amy, and we make up Sacramento Cornerstone Childbirth. And my personal stuff, we'll just go ahead and say it at the end of where you can find us individually. But together, we teach the Cornerstone method of childbirth education.
And our biz is called Sacramento Cornerstone Childbirth.
Did I say that? I thought I said that.
Oh, you might have.
Oh, it's okay. We'll say it again and again and again.
Sorry, guys.
Because we want it to implant in your brain.
This is us in classes. We're a complete brain altogether. So we complete each other. Like the Jerry Maguire movie. Sorry, if you're younger than like 40.
Yeah, we kind of went off. Okay, so gentler C-sections today.
We have notes.
We have notes, yeah. So, what kind of birth are you planning? Sometimes we plan a vaginal birth. Sometimes we plan a C-section birth. So, however you envision bringing your baby into this world, knowing what your options are. We're always talking about options. Those are what we feel is as much as important as your providers and all the good stuff that comes with having a baby. So we want to make sure that you know that how you bring your baby in the world is a direct impact on how you are postpartum. So especially true when you are planning to have a vaginal birth, and then it can kind of take a turn and turn into a surgical birth, be it an urgent or an emergency surgical birth.
And, just like we mentioned, if you haven't already watched our Facebook Live on birth preferences, one of the things we recommend is even if you are not planning a surgical birth, and we like to call it surgical birth or belly birth, because it's still a birth, right?
Yes.
C-section is so cold, and, we use them interchangeably, but we really try to call them surgical birth or belly birth. But if you're not planning on going that route, we still feel like it's valuable to get informed about your options, as Jen was saying, in the event that things change. Whether you decide to elect for a C-section after having labored, or like Jen was saying, it be an urgent or emergent situation. Today, we're going to share options for a gentler version of a belly birth. And so, it goes by many names. So we've heard it called a gentle C-section. We've heard it called a family-centered cesarean. And we've also heard it called a natural C-section, which you might think, how is that even possible? It's a surgery. It's actually a major abdominal surgery. But the natural piece comes in with the sort of options that you access along the way.
Definitely. So we want to acknowledge first and foremost that preventing a primary C-section is important in reducing the likelihood of repeat C-sections with subsequent pregnancies. We want to also acknowledge, like Amy mentioned, it's a major abdominal surgery. And so we want to kind of stave off that primary C-section for reasons that may not be in the best interest of the patient. But let me go ahead and get my notes because I want to say this word for word that we have here. So ACOG, which is the American College of Obstetricians and Gynecologists, in its paper entitled Safe Prevention of the Primary Cesarean Section in 2014 states, Although the initial cesarean delivery is associated with some increase in morbidity and mortality, the downstream effects are even greater because of the risks from repeat cesareans in future pregnancies.
And, we looked at some data in our region and statewide, and in our Sacramento regional area alone, the range of VBAC, which is vaginal birth after cesarean, that success rate is between 14% and 34.8%. So not a lot of people are able to, for a myriad of reasons, go on to have a vaginal birth after C-sections. We definitely recommend what's called a TOLAC, which is a trial of labor after a C-section. So even if, you end up in a C-section, that trial of labor really does matter. You may want to look into the birthing location of your choice, their C-section rate. That can be really eye-opening. We're doing pretty good here in the Sacramento area. As of 2016, our local hospital C-section rates range from 8.9 to 18.3. Pretty good. The overall rate in California is 26%, so we're below the California average. Our entire country averages 25.8% C-section. But the World Health Organization, their newest recommendations is that we should be shooting for a 10% cesarean rate. And I have a quote here for you. 2 new HRP studies show that when cesarean section rates rise toward 10% across a population, the number of maternal and newborn deaths decreases. When the rate goes above 10%, there is no evidence that mortality rates improve. And that was in 2015. So that's why the World Health Organization doesn't recommend that regions, states, countries have these averages of 30%, 20% even. We're shooting for 10%.
So we have some work to do.
We do.
So why might a cesarean section be recommended by your care provider? I can list the following reasons in their cesarean section frequently asked questions section. ICANN is International Cesarean Awareness Network, just so we get that out there.
Great resource.
Absolutely. So obstetrical emergencies like prolapsed cord, that's when the cord comes through the cervix prior to the baby, so it comes out first.
Placental abruption, where part of the placenta separates from the uterine wall before the birth.
Placenta previa, and that is when the placenta is actually covering the cervix opening.
Placenta accreta, where the placenta is too deeply embedded in the uterine wall and has potential for maternal hemorrhage.
Eclampsia and preeclampsia, which is a pregnancy induced high blood pressure that causes toxicity in the body of the pregnant person. And it can actually be fatal for both mother and child.
And other common reasons we hear for cesarean, and we're still quoting ICANN here, fetal malpresentation such as transverse lie or breech. Many women are not given a full range of options such as vaginal breech birth with a skilled provider or external cephalic version to turn a malpositioned baby. And in our Sacramento regional area, we have a gem in Annette Feinberg, who is an obstetrician who is based in Davis and practices in Davis, but she also has privileges at Sacramento Sutter in downtown.
Yeah,
considered downtown there. Yeah. So she has privileges to attend breech births as long as they're qualifying breech births. So you have to be evaluated by Annette Feinberg at her offices in Davis. If you're a great candidate for a vaginal breech birth, then she can attend your birth at Sutter Sac.
Total gem. So other reasons is suspected cephalopelvic disproportion. They call it CPD for short. And that means that the head of the baby is too large to fit through the pelvis. So the actual condition is actually very rare, and is often overdiagnosed. And so many women do go on to have vaginal births after a cesarean for CPD.
Definitely. And then other maternal medical conditions such as an active herpes lesion, severe hypertension, diabetes, etc.
And then we have fetal distress. And this is a very hot topic with recent studies indicating that continuous fetal monitoring increases the cesarean rate and does not show a relative increase in better outcomes. So please discuss with your care provider how they define fetal distress and what steps are used to remedy the situation before heading to a cesarean.
Whew.
Heavy stuff, right?
Now that we've gotten that off our chest. So, we're invested in helping our clients avoid C-sections if that's their goal. There are also people who elect for cesarean births for lots of different reasons. One of them being trauma.
Yes.
Past trauma. So yes, we see real value in preventing that primary C-section, but they happen, and we want you to know what your options are. So Jen is going to run through what a typical surgical birth looks like, and then I'm going to share some options that you might not have thought about being options at your birthing location.
Okay, so here is what we have for the traditional, per se, cesarean birth. A catheter is inserted to collect urine because you're not able to go to the bathroom on your own. An intravenous line is started, so IV. And add acid for your stomach acids because they want to keep those at bay. Monitoring leads, so you're hooked up for heart monitors, blood pressure, anesthesia is given. Depending on where you are in having a cesarean, be it an urgent or an emergency, depending on how your anesthesia would be given at that point. An antibacterial wash of the abdomen and partial shaving of the pubic hair. Skin incision, so vertical or midline. The midline is the most common. Uterine incision, so once they go through the outside and work their way in, they go ahead and make a uterine incision. They break the bag of waters. They disengage the baby from the pelvis, so if the baby's head is already in zero station or beyond, they have to take the baby out of the pelvis. And so the birth itself is accomplished by hand or forceps or vacuum, hands being the most common. Cord clamping and cutting. Newborn evaluation. The placenta is removed and the uterus is repaired, meaning sutured together back. And then, again, working your way back out, suturing, and the top layers are usually stapled or they have these adhesive type strips that they can repair the outside with. The skin sutures are usually left in for about 2 weeks, so you have to go back to have those taken out. And then you will move into the recovery room where the baby will then be able to go with you.
All right, so all or most of that will happen regardless of whether you have a traditional cesarean section or a family-centered cesarean section. But we have some options that can humanize the experience a bit and bring reverence to what is happening. A birth, a baby is being born.
I would like to quote a small part of a film that we actually show inside of our classes of the doctor who is kind of explaining how this family-centered cesarean works. And it's super fantastic because the obstetricians, the surgeons who do these surgical deliveries, they do them a lot. You know, that's their job, is to do these surgeries. And so they become very routine. And so does the interaction with the laboring person becomes very routine. Yeah. But if we flip it over on the flip side of the person having the baby, the partner, this may be their first birth, or any birth of a baby is an event that should be memorable and not treated as an assembly line or just the next name on the surgical roster. So I love that that he says that we want to humanize the experience and make sure that it is an event, not just a routine type of in and out thing.
Thank you. Yes. I love that guy. We should actually, I'll put a link to that video that we share in class so you guys can all watch it. You know, every time we wrap up our lives, we put a bunch of information in the comments. We give you all the links that we reference, as well as other helpful resources. So make sure you check the comments after you watch.
Take a peek at all that good stuff.
Okay, so here are your options.
Yeah.
So, number 1, you might not want to hear about the golf game happening after your baby's birth. You might not want to hear about the last birth that happened in the OR. So you can request for chatter to be kept to a minimum in your birthing room. You can bring your own music to be played during the birth. This one is a new one for me, and you're going to have to check with your care provider.
Definitely,
because I think there are some sterility issues.
Yes.
But on NCBI, which is a resource that we absolutely love for all things birth, one of the things that is a regular protocol of a hospital that caters to clients and patients that want to have a more family-centered C-section is that they can wear their own clothing. I don't know if that's an option out here. It's worth asking about. So the pulse oximeter that measures your pulse is normally on your hand, but you can ask for it to be placed on a toe. Because if you have this thing on your finger, it might be cumbersome with the wire attached when you want to be embracing your baby. EKG leads are usually placed on the chest, but who wants to put their baby on those discs, So you can ask for them to be placed on your back, and they will pick up your heart tracings just as well. You can ask for I think they do this routinely, right? The IV in the non-dominant arm.
Yeah.
But, just as an extra precaution, right? So if you don't want it, if you're right-handed and you don't want it on your right arm, ask for it. You can have the drape lowered. We don't usually recommend that you have it lowered before your baby starts emerging, but if you want to see all the stuff, you can ask for it. The most common time for the drape to be lowered, because there is a drape that's put up right about your chest level so that you can't see what's happening. If your partner is seated next to you, which if your partner is squeamish, I do recommend you ask for a chair, because if you're standing, you might see it.
Yeah.
You might see all the stuff. But asking for the drape to be lowered so you can see the birth of your baby, you can see the baby emerging from your belly, that you just don't get that.
Right. And just to add, just because of the way that you're laying pretty flat. So you're not, your head's not raised up or anything like that. So when the drape is down, you're going to see what you would see if you were laying in your own bed flat. You're going to see your belly. So, and the incision is pretty low. And so you're not going to see a lot of the surgical part of it. Because you're going to be pretty flat. So you'll be able to see your baby come up.
Yeah. And some hospitals do have a clear drape, so you can see the whole thing, but most of them are that blue,
surgical blue.
Yeah, and that you can't see through. Yeah. So asking for it to be lowered right before baby emerges is one of your options. When a baby is born vaginally, they get what's called the squeeze. And what happens during the squeeze, because, baby's coming through a small opening, their lungs get squeezed, and the fluids that have been in the lungs get expunged that way. And babies breathe better when they're born vaginally. They don't have to what am I?
Routine suctioning.
Right. That's what I was looking for. Thank you. See, one complete brain. So, babies who are born the traditional route of a cesarean section come out very quickly, right to the warmer, need some extra suctioning to clear the fluids, and then you might hear the baby cry at that point. So you can ask for, as long as, your care provider is not concerned about the health of yourself or your baby, you can ask for a slower emergence from your belly so that baby gets a simulated squeeze. And then he or she has a more of a fighting chance at breathing fine after birth. Delayed cord clamping. So now baby's out, right? You can request delayed cord clamping as long as there are no concerns about the health of you or your baby again. You can ask for them to delay cord clamping. One of the things we teach in our class is the history of delayed cord clamping. So it's done routinely for preemie babies born the cesarean route. So why wouldn't it be beneficial for a full-term baby? Typically in Jen's version of the C-section, both of your arms would be strapped down. And that's to prevent you from kind of freaking out about what's going on with your belly and putting your hands in that sterile environment. Whoa, my hands look really big because of the angle. Anyway, and so typically both arms would be strapped down to resist that reflex. Right. But you can ask for one of your arms to be left free so that after delayed cord clamping, baby goes right to your chest and you can embrace baby with that free arm. Let's see, where am I? So immediate skin to skin, I guess, basically, I've already explained that. As long as baby's doing well. If there's no reason for baby to go routinely to the warmer, he or she can be on your chest. Your chest will heat up to the exact temperature that your baby needs in order to regulate his or her blood sugar, heart rate, and temperature. So they're going to put a warm blanket over the baby. In that same video that Jen referenced, in the UK, they actually put bubble wrap over the baby, which we always
cute, but
we don't do that in the States, or we certainly don't do it in our region. We haven't heard of that. But you are going to heat up to the temperature that your baby needs in order to keep your baby well. So immediate skin to skin facilitates bonding, facilitates breastfeeding. If your partner would like to cut the umbilical cord, now obviously you can't be in the sterile field, so the obstetrician is not going to ask you to walk around and cut the cord there, but they can leave the cord a little bit longer than they normally do, have it clamped closer to where baby's belly button will be, and then the partner can still make an incision as a symbolic cutting of the umbilical cord. Okay. You can start breastfeeding during your repair. So Jen mentioned they're going to sew you up from the inside out. So they close up your uterus, they close up all the layers of your skin, and during that repair, you can start breastfeeding. Again, like if baby is doing well, there's no need to separate the two of you. The repair takes about 20 minutes. The whole event is like a half hour to 45-minute scenario. And so, the repair is about half of that time, and you can be with baby partner in the room with you during that time. You can also request to have all newborn procedures delayed until after that golden hour. We talked about the golden hour in a natural birth, right? In the birthing room. Well, you can still have it in the operating room. And so that's your vitamin K shot, your Hep B vaccine, ointment in the baby's eyes. If you're opting for those things, they can be delayed until after the golden hour. During your repair, it's super bright in there. Yeah. I mean, we've both been in the rooms. It's bright white light, which, if you watch cesarean births on YouTube, you always see the birthing parent shading the baby's eyes. It's just super bright. So during your repair, you can ask for the lights to be dimmed. They're still going to have a spotlight on the surgical site so that they can see, and you want that, right? You want them to do a good job. But you can have the ambient light dimmed.
And when that happens, your baby's eyes open.
Yeah, very sweet. You can request that your doula comes in the room with you. Now, it is up to the anesthesiologist. There's very little space usually up at your head. There's usually a bunch of machines. The baby warmer is very nearby. The anesthesiologist is there with all of his equipment. And so it really is up to the anesthesiologist whether or not a second support person can come in, but it's worth a shot.
Always ask. You never know.
We have been invited into the rooms, and it's really an honor to be able to continue to support our clients once a C-section has become a part of their birth story.
Yes, definitely.
And finally, we have one recommendation. Sometimes when babies are born, whether they're born in a labor room or an operating room, sometimes they need to go to the nursery or a NICU.
Right.
Our recommendation with that is that partner goes with baby, and then if there is a doula present, whether or not she or he is in the operating room with you, that you tag in and out. So partner goes with baby, doula stays with birthing person, and I always tell my partners, bring your phone, take pictures and video of your baby, send them to me. Obviously, the person on the table is not going to have their phone,
right?
But that is a way to stay connected to your baby if there is a separation. So that's our hot tip in case of a separation. Whew, that's a lot of options.
It's a lot of options, which, sometimes we don't realize our options until we know them. Yeah. And so just to kind of tie that together, if there is any type of discussion happening, of course, we want you to think ahead and have this in your birth preferences. But when the time has come that there is a discussion about a surgical birth that is a possibility, be it prior to labor or in labor, any of that kind of a thing, if you're having this discussion, you can reiterate your wishes inside that room of the surgical room having your baby. To make sure that all these good things are happening that you wish to happen. So that's the difference between an urgent, possible urgent or elective cesarean or surgical birth to an emergency where, of course, the options are quite limited at that point if it's a true emergency, and, we would want it that way. The goal at an emergency cesarean is to get the baby out fast. So, but if you're having a discussion, you have these options, that whole list of options that Amy shared with you. So have at it. So if you have had a surgical birth, there are fantastic postpartum resources to help you recover from this major surgery. And it can also help emotionally with kind of going over what you're feeling after having this with other people that have had the experience with you. And so we like to point out ICANN again of Sacramento, and we'll link their website into the comments and their Facebook page, but they are awesome resource. They have meetups and a ton of great information on how to get to the next step after having this surgery. And in the links that we're going to include, I have the main ICANN website also, so that you can search for your chapter. Definitely. If you're outside Sacramento. Perfect.
Absolutely. So we're biased. We're biased about doulas. We see the benefit firsthand, and we're not the only ones. There is research out there that states that having a doula by your side, whether it's a labor room birth or an operating room birth, can benefit you in lots of different ways. And I do want to leave you with a quote And, you know, the first place we start when we look for stats is we go right to the source. We go to ACOG. This is what your obstetrician's professional organization says about birth. And so, you know, this is like firsthand information that they receive. So, you know, if you have a care provider who's challenging you on, you know, one or more of those or the benefits of a doula in the room, bring them this information. Maybe they're not aware.
Point them right back to their own organization.
Absolutely. And you better believe there's going to be a link to this in the comments. So here's the quote that I want to share with you. Published data indicate that one of the most effective tools to improve labor and delivery outcomes is the continuous presence of support personnel, such as a doula. A Cochrane meta-analysis of 12 trials and more than 15,000 women demonstrated that the presence of continuous one-on-one support during labor and delivery was associated with improved patient satisfaction and a statistically significant reduction in the rate of cesarean delivery. That's page 111. Given that there are no associated measurable harms, this resource is probably underutilized. So that's our mic drop, right? If we had one, we would drop it. Still, even after, you know, this information, only about 6% of expectant families are inviting a doula into their birthing space. So, you know, it can be an access issue, and a lot of us try to mitigate that by offering sliding scale, free or reduced services. I know a lot of us just, you know, we have, it's like, honestly, like to give you a personal experience of where this comes from. My wife and I had a home birth. We had midwives who, you know, they charge, they have enough clients that charge full or pay full fee that they can take on one or two scholarship or reduced clients per month or per period, you know. And so a lot of us offer those services. So I know personally for me, I make priority for reduced and sliding scale fees for people of color, people of the LGBTQ community. We also do that for our classes. Yes. We save one childbirth ed spot per session that we teach for a scholarship student. We ask them to pay a $50 materials fee, but that's a $400 value for a 20-hour class that you're getting for $50. So, you know, we want you to have access to good information, experienced birth support. So, you know, talk to us about your needs, or if we don't meet your needs, we will connect you to somebody in the community who does. You know, I think if more people were able to access birth support, they would.
Definitely.
So we need to get the word out to people who are not aware of the benefits and the research that backs up the benefits.
And that's, I think, an added bonus of taking our class if we have to put on a cute little doula hat, because you get 2 experienced doulas
for the price of
one admission to a wonderful childbirth education class. So if I had to toot our horn, that was it.
And we have a lot of fun.
We do.
We're getting great results from our participants. Jen has a whole document with all of our testimonials from our classes. And if you check out our Facebook page on Tuesdays, we always post one for Testimonial Tuesday. And I also wanted to mention that we're starting to get feedback about our Facebook Live videos. So we're really glad.
And Instagram. Don't
Absolutely.
forget that.
Yeah, Instagram. Simulcasting on Instagram. People are starting to let us know that they're finding these informative. They're learning things that they had no idea about. And so we're going to keep doing these until you say, stop, we're good, and we should mention that you are leaving me for like 2 weeks. Jen's leaving me.
It's a very good reason. I'm going on vacation.
Yeah, she needs it. She's earned it. So I will still be here.
Yay!
And if you want me to, I will do Facebook Lives. I told Jen I'm going to stay on this side so that she has like an honorary
homage
in
to
the
me
video.
over here. Yeah.
We'll do like a hologram or something. But put down in the comments what you'd like me to talk about. I'll tell you birth stories. I'll pick, one of the fun things that we do in class and kind of highlight if you want to learn more about our classes. Definitely. So, I'll suffer through it without you. You know what? One thing I did think would be valuable to talk about, what we talk about in class in terms of the difference between an urgent and emergent C-section, because we're trying to shift the language.
Definitely.
Okay, so when we disclose, when we out ourselves as doulas to people that we talk to on the street, inevitably people want to tell us their birth stories. So we get all the stories, and we read all the Facebook groups, and read about people telling about their birth. And first, I just want to say that we by no means want to rewrite your birth story or negate your feelings or tell you, well, no, actually you didn't have the birth that you thought
you're
you
wrong.
had. Right. Not our style.
No.
And we also are very passionate right now about shifting the language that is used around cesarean section births. So I haven't had anyone tell me that they've had anything other than an emergency C-section, right? So, oh, thank goodness we were at the hospital. We had an emergency C-section. Cord was wrapped around baby's neck. That's one of the myths we talk about in our class. Not always an emergency. In fact, not usually an emergency. Maybe I'll talk about that.
Talk about that.
I can talk about myths next week. So anyway, if you want to hear about myths and misconceptions, I can talk about that. But anyway, so, when we hear I've had an emergency C-section, the visual that is brought up for us is you have the mask on your face, you went to sleep, your partner was not in the room with you. That is an emergency C-section, okay? Now, they can be urgent, right? Definitely. Do you want to say anything about that?
So, urgent, if there was the spectrum of surgical birth, we would have emergency on one side, elective. Yep. So you totally chose to have, for whatever reason, to go in and have a surgical birth. So it was, sometimes you would hear it a scheduled cesarean. So that's beyond the spectrum. And then we have everywhere in between. Yeah. So urgent kind of falls in the middle of emergency and elective. So it could be that you are in labor and you've been laboring, and then one of those things kind of came up during your labor. And so the discussion is happening of having a cesarean instead of continuing your labor and having, a vaginal birth. If there is discussion, it's urgent, not emergent. Yes. So it's somewhere in that spectrum of, just think of it, if there is a conversation, it's not an emergency. So
we want to, they're not wheeling you to the OR, having you sign
papers
quickly,
you have time. Yeah. So if sometimes and this is what I've been seeing in my own practice, is that the conversation has started way before you even get to that point. Yeah. So if, for whatever reasons, if something is being picked up on monitoring or with the dilation process, any of those types of things, they usually will say, we're not there yet, but we want to open the conversation about cesarean. Not an emergency. That would be more of possible urgent, working maybe towards that, but we, like we say, birth is a mystery, so we never know what can happen in between that conversation and having a surgical birth. So wide range of how you get to having a surgical birth. Like Amy said, we don't want to, everybody has their own truth about what their experience are. So if we were talking to someone on the street, like Amy said, we wouldn't change their truth. We wouldn't try to rewrite their birth story or anything like that. But I think the goal is to get the information out there. So when you are faced possibly with having a surgical birth, that I think having a conversation that doesn't have the word emergency in it is a lot better postpartumly. On healing and emotional wise and all that kind of good stuff. So changing the language. Changing the language.
Absolutely. You jogged my memory about something that I'm going to be doing at every birth that either is scheduled to be a cesarean or elected at some point along the way or becomes urgent. So I'm not going to share any identifying details, but a very recent birth that I supported, the client elected to have a cesarean birth. They put her in the wheelchair, wheeled her off to the OR, sat her on the operating table, and as she was, because you have to curl over and make a nice wide space, that is a really bad angle. They have to make a nice broad space for the spinal medication. And as the needle was piercing her skin, she said, "Oh my goodness, I think I'm pushing." Nobody believed her, but she said, "No, you don't understand." They checked her. Baby was crowning. Baby came out in 2 pushes. While she was seated on the operating table. So
you never know.
You never know. If you're not feeling great about your decision or you still just want to know kind of where you are, you can ask to be checked before they operate on you. Even if you're in the operating room, right? Or just before you go to the operating room. If you're a 9 or a 9.5 centimeters dilated, and it might be urgent, or maybe you've elected to have a cesarean birth at that point, maybe you'll change your mind. Maybe your care provider will say, "You know what, let's just see how it goes." So, nothing against cesarean birth, but
absolutely not.
They come with a lot of risks. And so if your goal is preventing, then there's another option for you.
Definitely.
You're welcome.
And one last thing, I think last thing before we I think this is our longest so far. And we have 16% on the laptop. So we got
let me grab the charger.
I think what we also want to make sure that you are aware of, that we have a big misconception. I think that still floats around the birth community, that once a cesarean, always a cesarean, and that is wrong. So we already mentioned the VBAC, the vaginal birth after a cesarean, the TOLAC, trial of labor, after cesarean. So that's not true. There's really only one factor that would, make that a true story, and that is a type of incision that you would have. So you would have a vertical, and that would be a super big emergency why they would do it that way. That would kind of put you at higher risk to any other type of labor or anything like that. So that would be really, I think, the only reason why you could not try for a vaginal delivery after a C-section.
All right. Whew. Did we get it all out of our
system? I think we got it all out. This is kind of cathartic.
I know.
Kind of just kind of spit all this information at you.
Thank you, Facebook therapist.
Okay, so how do you get a hold of us? Amy, go.
I'm going first. Okay. Website, riverbendbirthservices.com. Facebook, same name, Riverbend Birth Services. My Instagram handle is @Sacramento Doula. I think that's it, right? Oh, phone number 916-769-7648 and email amy@riverbendbirthservices.com.
Okay, so I am Belly to Bliss Birth Services, so you can find me at bellytobliss.com. You can find me on Facebook at Belly to Bliss Birth Services. Email would be jennifer@bellytobliss.com. And phone number is 209-322-5271.
And Sacramento Cornerstone Childbirth is our joint business that we got going on here. And we are so excited to announce that we have our website ready for you. So please visit saccornerstonechildbirth.com. That's SAC cornerstonechildbirth.com. And we have our upcoming classes listed at the bottom of the one-page website. There's a link to our online registration form. So, if you are ready to register for a class, you just click that link. It'll come right to us. We will send you an invoice electronically so that you can pay for your class. I do want to just add another pitch that our doula clients are given $100 off the cost of a childbirth class with us. So if you hire one of us to be your doula at your birth and you'd like to take our class, we will offer that savings to you.
What else was I going to say about our website? Oh, it has more information on the method.
Yep.
So that's super important to get to know the method. But if you have additional questions after visiting our website, please email us at cornerstone, right?
Yep.
childbirth@gmail.com.
All right. Or I field all the phone calls, so you can call me with questions about the class. Again, 916-769-7648.
And then you can find us on Facebook at Sacramento Cornerstone Childbirth.
Yep.
And on Instagram at Sac Cornerstone Childbirth.
And this is video number 4. So if you're just catching us for the first time, go back to the beginning. We introduce ourselves. We talk about the method. One of our videos is on birth preference documents, formerly known as birth plans. Last week we talked about, what did we talk about last week? Oh, rights in the birthing room.
Rights in the birthing room. Gosh, how important is that, right?
Kind of a big one. Kind of important.
Yes.
All right.
So we will be on here forever, all of our videos. So catch up if you haven't seen us before. And stay tuned for Amy next week.
I'm going to miss you. Do you want to tell them where you're going?
I'm going to London and Ireland on vacation.
Poor Jen.
I know.
It's going to be horrid.
It's going to be awful.
All right. She'll tell you all about it
Definitely.
when she comes back in 3 weeks, right?
Yep.
So, all right, guys. Thank you so much. Who do we need to thank? Kim says, LOL, wow. Oh,
we were calling her out a little.
Yeah. Hey, you know what? There's no shame in our game. Thanks for watching, Cassie. Thanks for watching, Jolene. Emma was on. She says we're fabulous. Thanks, Emma.
Yes, we are. Sorry.
And then Sarah Elizabeth was watching. You want to check Instagram?
Oh, this is going to look bad on the camera over there. I believe Sarah was also on Instagram, and I can't see anybody else, unfortunately, but we will call you out when we get off live.
We need it like right here. Because
our setup needs to be worked on.
All right, guys. Have a good one.
Bye.
If you're in Sacramento, hope you enjoyed the rain.
Oh, yeah. How about our poll?
Oh, yeah. Did anybody take the poll?
If you haven't, let us know where you're watching today. We want to see our reach. So
it doesn't look like any of you have answered our poll. So if you want to answer our poll and let us know where you're watching from, we know all these guys who've commented down here. I didn't see anybody that I didn't recognize. But if you're watching on the replay, we'd love to know where you're watching from. All right.
That's it.
Are we done talking at them?
Yes.
All right. Thanks, everybody.
Have a great week.
Bye.
Bye.